My name is Brent Agan. I'm an MD specializing in family medicine. While practicing medicine, I encountered patients who were taking antidepressant drugs like Celexa, Cymbalta, Paxil, Prozac, and Zoloft, antipsychotic drugs like Abilify, Geodone, Risperidol, Seroquel, and Zyprexa, and benzodiazepines like Ativan, Klonopin, Valium, and Xanax. There were many times when these people complained the drugs were not working for what they were initially prescribed: nervousness, agitation, or depression, and were creating many side effects. In many cases, this reaction was not surprising. We were taught in medical school that the symptoms of depression were also the symptoms of endocrine gland problems and problems with hormones like testosterone, progesterone, and estrogen that are produced and regulated by the endocrine system. Here's a diagram to show the endocrine system: the thyroid, the adrenals, the pineal gland, the thymus gland, the pituitary gland, the pancreas, the ovary, and the testes. Many people are familiar with problems created when hormones are not balanced, but most do not know that when a person has problems with these glands, they will likely experience symptoms such as fatigue, weight gain, weight loss, memory and mental impairment, concentration, depression, nervousness and irritability, heat intolerance and increased sweating, tremors, mental disturbances, sleep disturbances, insomnia, and even sexual problems. In addition, many of these people were also suffering to a greater or lesser extent from the effects of dehydration. Even people who drink a great deal of water may still be dehydrated if they do not have the proper electrolyte balance. Some of the symptoms of dehydration are constipation, lethargy and fatigue, dizziness, agitation, restlessness, dry or sticky mouth, excessive thirst, headache, muscle weakness, and confusion. I explained to these patients that they may have to continue to take the antidepressant or the antipsychotic or a benzodiazepine for the rest of their life, but it is possible that the cause of their unpleasant or uncomfortable symptoms may be an endocrine problem, a vitamin or mineral deficiency, or even dehydration. An example of not treating an endocrine problem would be like going to the dentist and complaining of a toothache. The dentist finds decay, but instead of fixing it, just gives you Novocaine that you rub on the gum to deaden the pain. Untreated, the tooth will just continue to decay, and when you do address the real problem, instead of a simple filling, you'll need a root canal or maybe even have to have your tooth pulled. If they are interested, then we do a very thorough history and seek to determine when they first started to experience the symptom or symptoms that caused them to be prescribed the drug. Then we order blood tests that will show if there's an endocrine problem, dehydration, or even electrolyte imbalance, problems with vitamin or mineral deficiencies. If the problem causing the unpleasant symptom is diagnosed, then the next step is to begin treatment of the problem. As the treatment progresses, we can slowly begin to lower the doses of the prescription drug until the patient is no longer taking it. This is all done under medical supervision, and if it's medically necessary to continue the drug, it'll be done. However, in most cases, if a medical cause is found and properly treated, the patient will no longer need the drug, will no longer experience the uncomfortable symptoms, and will find that their health is improved. If you would like to learn more, please discuss with your healthcare provider how this information may apply to you or to someone you know. Again, my name is Brent Agan, and I'm a wellness physician.